Broke my back in 2 places and crushed my entire left chest in and punctured my lung. And I had to be medevac to Kalispell Medical Center in Montana, where they fused my spine from my thoracic 9 to lumbar 2. The pain got worse and worse, and I had to take more and more opiates to control the pain. It got so bad that I couldn't stand it any longer. Who fused my lumbar 2 to my lumbar 3. Everything from Norco to OxyContin, oxycodone, eittreim, muscle relaxers, sleeping aids because I couldn't sleep, and the pain wouldn't go away. You become socially isolated by your pain because people don't want to see you suffer like that. Pain that probably went from 7 to 10 all the time. At times it was so bad I couldn't stand it. I would just, frankly, I got to a point where I wanted to die. It was.
Wow. What's interesting about some of my patients, for instance, Mark Owens, is that he did not even have a surgical lesion.
It's going to take 2 surgeries. It'll take probably at least a full day and probably 2 days. In the end, he said, we're going to fuse you from your collarbone to your hips.
I mean, his spine was normal for he had disc degeneration, which has been shown not to be a cause of back pain.
So a total of, I can't remember, but at least 8 different specialists. He walked into the room and he said, well, I've looked at your images. I don't see anything in your spine that should be causing your pain. And I said, what?
There wasn't 1 second I thought this needed surgery. It was just a degenerated spine. So then I talked to him a little bit about chronic pain, how I'd been in pain, and then I suggested to start these writing exercises.
And I thought this was snake oil, to be honest.
Right.
I mean, I really did. I thought this is just some other, it's kind of a sort of thing you'd pick up off the internet with people making empty claims without any science behind it, etc.
I didn't expect it to work. I was dubious even after it was working. Even today I'm dubious.
I've been practicing in Seattle since 1986. I train in a spine fellowship called Twin Cities Scoliosis Center, which is considered probably one of the top 3 spine fellowships in the world at the time. And I came to Seattle in 1986 sort of on fire, doing surgery on everything I could do surgery on. And I felt obligated to do that. So I was aggressive. I dealt with the most complex spine problems that existed at the time. I deal with much more complex spine problems now than I did when I first started. So I'm basically Seattle's senior surgeon. I'm also the most complex surgeon in town. Paradoxically, as I've become more expert at doing surgery, I found many more ways to get people better without surgery. So what the book offers is a structure that breaks a complex problem like pain into different parts.
The book Back in Control.
Right, the book Back in Control and the website, it breaks pain into its different parts. And since pain's complex and you're complex, you're the only one that can solve the problem.